When you are able to treat it in your practice, how do you actually treat it? What are some of the medications that people are prescribed commonly for sinus problems?
Right. That's a very good question, because there's a whole broad series of treatments that you can do. And one of the things that I like to talk to my patients about, and again, being from Tennessee, I use local colloquialisms, is what I call the beaver dam scenario. Okay. The beaver dam scenario is you're a farmer, you have a creek on your property, creek's running smoothly, it's flowing well. Beavers come along, they build a dam on the creek. Once they build that dam, it backs up. And where you used to have good farmland, now then you've got a pond and you can't produce on it, and the beavers are creating problems. So you need to go in and blow up the dam. If the farmer blows up the dam, then it'll flow freely for a while, but the beavers will rebuild it. If the beavers are relocated by the farmer, he still has the pond to deal with. So you have to both blow up the dam and relocate the beavers. You can't do one or the other. And that's crucial to treatment, because if I have sinuses that are blocked and obstructed, that's the dam. And if I go in and treat them surgically or medically, either one, but I don't treat the underlying cause, then the patient will be back in the office. And one of the reasons that patients get the false impression that they really don't get an improvement from surgery or from other treatments is because somebody may blow up the dam, they may do the surgery, but they don't treat the underlying cause.
Right. And
so the problem comes back in 3 to 5 years. Medicines that we use vary. We use everything in patients that are allergic. We use antihistamines. We use allergy shots. We even do a thing called sublingual immunotherapy, where instead of the shots, you take drops and you put them under the patient's tongue, and that builds up the immunotherapy. If the patients have reflux, we try and control that. We'll put them on medicines to thin out their secretions, steroids to decrease the inflammation, and try to open up the passages. And part of that is to open the dam. Opening the dam doesn't necessarily mean surgery. If I can open the dam with steroids and medicines, you may not need a procedure.
When a patient comes to see you, can it be, I guess, challenging at times to determine if it's a cold or allergies or if it is a sinus infection?
Well, interestingly enough, most of the time it's pretty straightforward, and it's because of the examination. When you look at the inside of a person's nose, what you'll find is with an acute infection, most of the time it's inflamed and red, but with a chronic allergy, it's usually blue. And the reason that you see the blue color is because the blood is sitting there, but the chronic congestion causes prevents the blood from leaving the area, but the oxygen leaves the area. So the oxygen's used in the tissues, then the color becomes blue. When I'm teaching students and residents, I will tell them that you can really walk down a grocery store and determine who has allergies and who doesn't almost just by looking at them.
At what point do you determine that surgery is probably the best option for a patient?
When
the antibiotics aren't
fails.
working? Right. So you do try everything else.
Right, when everything else fails. Surgery should be the last option, not the first option. Having said that, we do a lot of surgery in Knoxville because we have such huge number of patients that actually have this disorder, and it's difficult to treat on occasion.